So welcome everyone to ID at Home, a virtual conference meant to bring patients, caregivers, clinicians, and researchers together.
When the pandemic kind of hit and things shut down, we really tried to figure out how to change the health system to be able to continue to do research remotely, change clinical care to be able to do it remotely. And so I think these three panelists will be able to speak to that.
And so the point of all these numbers is really that we're looking at 17 million plus patients who are going to have prolonged symptoms of COVID-19.
We went through a debate here on the Hill, an important debate on comparative effectiveness research, but we wanted to drill down even further, and ask, what treatments work best for what patients? And in order to get an answer to that question, you need to engage the patients themselves.
We do this through 5 main objectives that we have as an organization. We work to reduce health disparities.
And I have to tell this group just how impressed I am at how much Dr. Mullins and his team have been able to become part of our West Baltimore community. And the success that they've had in involving the community members, both in the design of research projects and in developing the trust with them to participate in these trials.
What I'm really going to focus on is how we invested resources and energy into engagement from providers across our health system.
Having that sustained relationship building over the course of the project when people are working together. And of course, as I mentioned earlier, using all those different tools to enable participants to feel like their voices are heard.
And another challenge that we continue to face, is that the symptoms of lupus are similar to the symptoms of COVID.
And here I am to talk to you particularly today about our experience during the pandemic and just in general, with a lens on social determinants of health.
Thank you all so much for being involved. I really appreciate your contribution, your time, and your willingness to come on here and answer questions and share with us.